joint, the manubrium and body lie in slightly different planes. The body of the sternum, longer, narrower, thinner than manubrium, locates at level of T5 through T9 vertebrae. Its width varies because scalloping of its lateral borders by costal notches. The hyphoid process, the smallest variable part of the sternum, thin, elongated, lies at level of T10 vertebrae, pointed, might be blunt, bifid, curved, or deflected to one side or anteriorly. The hyphoid process is an important landmark in the median plane. Joints of the thoracic wall is associated with respiration. Any disturbances that reduces the mobility of these joints interferes with respiration. During deep breathing, the excursion of the thoracic gauge are considerably increasing the anteroposterior diameter of the thorax. Joints of the thoracic walls occurs between the vertebrae, ribs and vertebrae, ribs and costal cartilages, interchondral joints, sternum and costal cartilages, sternum and clavicles, parts of the sternum, manubriosternal and hyposternal joints, costovertebral joints. A typical rib articulates with vertebral column at the joints. Joints of head of ribs, costotransverse joints. Joints of head of ribs. The head of each typical rib articulates with demi-facets or costal facets of two adjacent thoracic vertebrae. The head articulates with the superior part of corresponding vertebrae, the inferior part of the vertebrae superior to it, and adjacent disc uniting the two vertebrae. The crest of the head of the rib attaches to the foredisc by an intra-articular ligament within the joint, dividing the enclosed space into two synovial cavities. An articular capsule surrounds each joint and connects the head of the rib with the circumference of the joint cavity. A fibrous capsule is the strongest anteriorly, where it forms a radiant ligament that fans out from the anterior of the head of the rib to the sides of the bodies of two vertebrae and the foredisc between them. Heads of ribs connect to vertebral bodies, gliding movements occurring at the joints of the head of ribs. Costotransverse joints. The tubercle of a typical rib articulates with the transverse costal facet anteriorly surface of transverse process of its own vertebrae. Small synovial joints are surrounded by thin articular capsules attaching to the edges of the articular faces. A costotransverse ligament passing from the neck of the rib to transverse process, and a lateral costotransverse ligament passing from the tubercle of the rib to the tip of the transverse process, strengthening the anterior and posterior aspects of the joint. Superiorly costotransverse ligament is the broad band joining the crest of neck of the rib to transverse process superior to it. Opening between this ligament and the vertebra permits passage of the spinal nerve and the dorsal branch of the intercostal artery. The superior costotransverse ligament might be divided into a strong anterior costotransverse ligament and a weak posterior costotransverse ligament. The strong costotransverse ligament binding these joints limit their movement to slightly gliding. However, the surface on the tubercles on the superior 6 ribs fit in concavities on the transverse process. Costochondral joints. The costochondral joints are hyaline cartilaginous joints having a cup-shaped depression, its internal end into which the costal cartilage fits. The rib and its cartilage firmly bound together by the continuity of the periosteum of the rib with the periochondrium of the cartilage. Interchondral joints. This articulation between the adjacent borders of the 6th and 7th, 7th and 8th through 9 costal cartilage are plain synovial joints. These joints usually have a synovial cavity enclosed by an articular capsule, are strengthened by interchondral ligaments. The articulations between 9 and 10 costal cartilages is the fibrous joint. Sternocostal joints, the 1st to 7th rib, articulates through their costal cartilages with the lateral borders of the sternum as follows. The first pair of cartilages articulates with the manubrium only. The second pair of cartilages articulates with the manubrium and the first sternal segment. The third to fifth pairs of cartilages articulate with the second and third sternal segment. The sixth pair of cartilages articulates with the fourth sternal segment only. The seventh pair of cartilages articulates with the fourth sternal segment and the hyphoid process. The first pair of costal cartilages articulates with the manubrium by means of primary cartilaginous joints or synochondrosis. By this level, please take a look in your atlas the figures of movements of the thoracic wall. The synovial joints and they move during respiration. The weak articular capsules of these joints are reinforced, thickened anteriorly and posteriorly to form radiate sternocostal ligaments. continuing thin membranous band passing from the costal cartilages to the anterior and posterior surfaces of the sternum, forming a felt-like covering from this plane or plate of bone.